Top 5 mistakes made after a total hip replacement.
You're going to have your total hip replacement. Please don't make one of these 5 mistakes.
Welcome to Talking with Docs. I'm Dr. Brad Weening.
I'm Dr. Paul Valza. Do you think Watson and Crick had this much fun working together?
I don't think so.
Really?
I don't think so. The helix?
If we went back in time, I'd want to be Crick.
Why?
Because then you'd say, what's that double helix? And I'd say, it's elementary, my dear Watson. It's DNA. And you would say, deoxyribonucleic acid? And I'd say, yes, Watson.
I would not say that.
You would.
But I would like to talk about the top 5 mistakes people make after hip replacement. We've done a video like this before. It was during a dark time when we were wearing masks, and we'd kind of like to forget that video, so we thought we'd update it.
They were dark times wearing masks.
Okay, number 1 on our list of top mistakes.
Have a plan.
Okay. Well, the mistake is not having a plan.
Right.
Yeah.
Have a bad plan.
Yeah, sure. Or no plan.
Lack of a plan. So
okay, what do you mean?
You know you're going to have your hip replaced. It's not an all of a sudden surprise thing.
Right.
You've planned it for a while now.
Yep.
So have a plan of where you're going to go after. Are you going to have some help around after? And I think you will need someone around to help you for 2 weeks.
Sure, like how to get home, where you're going to sleep, how you're going to prepare your food, you know, how you're going to get in and out of the bathroom, how you're going to shower, all that kind of stuff. Little things that can become big things in the moment if you didn't plan for them.
Yeah, start putting some favors in the bank with the people around you now because you're going to need them later.
Make some relationship deposits.
Make a friend.
Okay, number 2 relates to physio or physical therapy that you do both before, prehab, and then afterwards, rehab. So exercises you do before to prepare for surgery and exercises you do after to recover from the surgery. And not doing these adequately and appropriately is mistake number 2.
Mistake number 3 that you could potentially make after having your hip replacement is not taking the medications that were prescribed to you.
Yes.
There's a few things you might get.
Okay.
One, you might get some kind of blood thinner to prevent a blood clot or DVT. If you are prescribed that, take it.
Take it till it's done.
Next one is pain medication.
Yep.
You will probably be prescribed some kind of pain medication. And you want to take that, especially at the beginning, because it's easier to keep the pain away than to make the pain go away once you get it.
And sometimes this is a narcotic, and we appreciate that people are nervous about this for good reason. There have been a lot of problems historically, so take them responsibly. But you don't necessarily have to be afraid of them, just be respectful of them and take them as appropriate and try to slowly reduce them. You don't have to stop them in the first 3 days that you start.
Right, and you're probably going to be prescribed acetaminophen as well.
Yeah,
that
maybe an anti-inflammatory.
Right, for a short period of time.
Yep.
So see what pills you were sent home with, what your doctor wanted you to take, and make sure you take them.
And I think this is actually also something that's worth talking to your surgeon about if you're concerned about this. Share your concerns. Say, listen, I've had this before, it didn't work, or I've had this or had problems with this before, whatever. Talk to them so that you can have a plan ahead of time.
Yeah, orthopedic surgeons are nice people.
Super nice people.
I met them all over the world.
You're so nice.
We like orthopedic surgeons.
Okay, number 4, specific to a hip replacement as opposed to a knee replacement is getting your hip into an extreme position. Once you have an artificial hip, there is a higher probability that you can actually lever your hip out of the socket. And if you do this, this can lead to something called a dislocation, which is a big problem. In the short term, it's a problem because we need to get it back in. But in the long term, it can become a problem because you could dislocate multiple times and sometimes even require further surgery to deal with this. So what do we mean by extreme positions?
Extreme positions are typically outlined as bending your hip more than 90 degrees.
Right.
That's a total hip precaution that we give people for the first 6 weeks to 3 months. Now the literature is changing, and some people are saying there's less of a need for these total hip precautions because of the implants have changed a little bit.
Yep, the approach is a little bit, the patience a little bit.
Right, so depending on the approach, there will be some associated precautions. One of them is bending more than 90 degrees or turning your hip out too much or turning it in too much. Even though there isn't a lot of scientific evidence to support using these precautions, I'm still a proponent of being careful and not putting your hip in an extreme position.
And we are going to do a follow-up video actually specifically all about dislocation because our video is pretty old. So we're going to do that later on. But so avoid extreme positions. No more playing back catcher once you become a hip replacement recipient.
That's it.
Okay, number 5.
You are pitcher only now.
Pitcher. Long toss. Number 5 is don't fall.
Look, we can't tell people not to fall.
I tell people literally don't fall all the time. So you can.
Falling is not something you do on purpose.
Okay, so how can you avoid or reduce your risk of falling?
Make your environment safe so that you're not going to fall. Watch out if you've got rugs on the floor.
Right.
You're going to fall. Watch out if you have areas in your house where there's a very small step, not a full step that you might forget about, or if
Right.
you're staying somewhere else that isn't your home, are there little steps that you're not aware about?
Wear sensible shoes. Watch out for kids' toys on the ground. And if you have a pet, particularly a dog, maybe think about getting a dog walker for the first little while. Maybe just be really careful with your dog, or train your dog before surgery to sit when you tell them to sit.
Right.
What do you think about that?
I like that. Actually, I've seen a patient who, another dog, it wasn't his dog, but another dog
Right.
had a leash and then ran around him 3 times.
Right. You got to drop that leash and
Then
it's bad.
and he fell, right?
Did he dislocate his hip or something?
No, he fractured his femur. He had a periprosthetic femur
you
fracture.
serious?
Yes, it was devastating.
horrible.
It is horrible. So put yourself in a position where you're not going to fall.
Okay, and then I would say honorable mention is doing too much too soon. We've talked about this before. Ideally, you want to reserve as much time as you can off of work or off your regular duties after hip replacement to focus on recovery. We recognize people that are self-employed or have jobs where they don't have benefits physically have to go back to work. So if you have to go back to work sooner than you anticipated, maybe try to have some modified hours, modified duties, make some accommodations, but really try to be as selfish as you can to get your hip good.
Don't do too much too soon, but don't do too little too late.
Right. So many rules. Okay, so a quick summary. Top 5 things to avoid or mistakes not to make after hip replacement. Number 1.
Have a plan.
Okay,
Or the mistake is don't have a plan.
Number 2, do your prehab and your rehab.
Take the meds that you're prescribed.
Number 4, avoid extreme positions. That's really for life, but especially in those first 6 weeks.
Number 5 is don't fall.
Don't fall.
Well, set yourself up in such a way that the chance of falling is very low.
Now you know, and if you've had a hip replacement, please share a comment with our other viewers about things that you did to help increase your chances of success, or even share maybe some of the shortcomings or mistakes that you made and things you wish you did differently.
There you go. And then other people who are thinking of having their hip replaced can review that list in the comments and also the list we just talked about.
There you go. If you like this video, please like it, subscribe to our channel.
It's elementary, my dear Watson. You are in charge of your own health.
We'll see you next time.